Okay, what is the core features of these dissociative neurological disorders? Okay, onset of neurological symptoms typically occurs between puberty and early adulthood, like 12 to 20 years, and is usually very acute. And the disorder may follow either transient or persistent course, depends on the etiology or nature of the stress. And onset is usually associated with traumatic or adverse life event like physical injury or child abuse or child neglect. In addition, usually the prior disease of nervous system will be there, okay, especially the pseudo seizure. PNAS is common when there is a history of true seizure, and this adds confusion to the diagnosis. Most often they end up treated like a seizure with escalating dose of anti-epileptics, and in the end, when the symptom doesn't settle, the dissociative disorder is suspected. So we have to be very cautious when there is a atypical symptom presentation in child who has already had seizure, or even with previous neurological illness. When they develop, the first thought of the consultant and the parents is the previous neurological disorder has relapsed. So they invariably get evaluated for physical conditions, and sometimes it results in significant delay in the diagnosis of the underlying psychological conditions. So positive prognosis in dissociative neurological disorder include younger age, acute onset. If the symptoms are very chronic, it has a little poor prognosis, like in any case. Short duration of symptoms and monosymptomatic presentation. If the presentation is very complex, then it has a poor prognosis. Early diagnosis and short interval between symptom onset and initiation of treatment. If they are suspected early and initiated treatment early, then it has a poor prognosis. And clear onset associated with identified stressor. For example, in other way, we have identified what is causing dissociation, and if we couldn't identify stress, then it has a poor prognosis. And good premorbid functioning and intelligence. Premorbidly well adjusted, a severe stress causing dissociative disorder, then the outcome is good. The premorbid functioning itself is less, and having lots of personality or temperamental issues premorbidly, and there is no clear identifiable stressor, because these are the commonly seen entities. There won't be identified stressor, the child has poor coping abilities, and there is poor functioning premorbidly. When they develop dissociative disorder, again it has a difficult course. And the family's acceptance about psychological nature of the condition. If the family is willfully accepting, or it is easily the consultant is convincing the family, then it has a good prognosis. Sometimes the family will be very hostile and not receptive for the diagnosis of dissociative disorder. Negative prognosis, non-transient symptoms, polysymptomatic presentation, more than one symptoms, comorbid medical condition and mental health condition. When it is associated with, for example, dissociative seizures is associated with true seizure, then it adds to the diagnostic confusion, it results in the poor prognosis. As I was telling, maladaptive personality traits, and sexual abuse has a poor prognosis, previous history of sexual abuse, poor physical functioning and overall functioning prior to the diagnosis of dissociative disorder. So these are the factors associated with poor prognosis.